Okay, welcome to the Davies Use Case webinar being presented by Petaluma Health Center on hepatitis C. The Davies winning use case for the value of hepatitis C. My name is Manager of Quality and Patient Safety, and it's my pleasure to moderate this presentation. Core to promoting the use of health IT to improve the quality of healthcare delivery. HIMSS and advocates the integration of clinical decision support and best practice guidance, access to clinical data to analyze progress, and IT-enabled patient safety tools for all healthcare organizations, clinicians, patients, and community members as vehicles for improving patient outcomes. The HIMSS Nicholas E. Davies Award of Excellence is the pinnacle of HIMSS Value Recognition Program. The Davies Award recognizes outstanding achievement of organizations from around the world who have utilized health information technology to improve patient outcomes and value. The award-winning use cases have been peer-reviewed to validate sustainable, improve the patient and business outcome resulting from health IT-enabled care delivery. Welcome our speakers for today's webinar. Dr. Danielle Warren is the Chief Medical Informatics Officer at Petaluma Health Center and Redwood Community Health Coalition, where she provides leadership for initiatives in clinical systems, health information technology, and quality improvement. Sean Nelson has worked for federally qualified health centers since 2010, where he is drawn to both the mission of the organization and the opportunity to use data to improve patient care and experience. Thank you both Danielle and Sean for joining us today. I'll turn this presentation over to you.
Yes. So today we're going to tell you a little bit about Petaluma Health Center and our initiatives around the screening and treatment for hepatitis C and how that was supported by Health IT. So I'm going to start with a few slides about Petaluma Health Center. We are a federally qualified community health center. We are located about an hour north of San Francisco in Sonoma County. We were founded in 1996, and we actually became an FQHC in 2000. We have about 29,000 patients, and we see about 150,000 visits a year in our two large sites, Petaluma Health Center, Rohnert Park Health Center, and then we have 4 satellites, which include 1 homeless shelter site and 3 school-based health centers. A broad range of primary care services at the health center. Like most health centers, we're really focused on full-spectrum, family-centered primary care. We care for both children and adults and pregnant women. Additionally, we offer a number of services in the wellness area, including acupuncture, chiropractic care, integrated medicine, nutrition, shared medical visits, which we'll talk about today, and community exercise programs. We have some limited specialty care that we offer on site as well. We offer eye care via ophthalmology and optometry. We have podiatry services. And we also offer on-site endocrinology and rheumatology via telehealth. We have had a long track record of working towards advanced models of care. As you can see, we have been for quite some time working in the patient-centered medical home model. As far as health IT values, we have a real culture of innovation at the health center. We have a belief that the technology that is used all around the country at other healthcare organizations, that even though we're a community health center, we should be able to provide the highest tech, best services to our staff and patients. And we also really believe in maximizing the value of the technology tools we have. So we really like to get the most that we possibly can out of our EHR, out of our analytics platform, and all our other health IT tools. Just a little bit about our patient population, because though it's typical for a federally qualified health center, it doesn't, it may not be typical for other groups. About 75% of our patients are at or below 200% of poverty, and 33, so a third of our patients are best served in another language, and in our case, that would be Spanish. And you can see that we have about a 50-50 Hispanic population, so we have a really diverse population that we're serving here. Before our case around hepatitis C, I think it's good to have a little bit of background information about the tools that we use here at Petaluma Health Center. We have eClinicalWorks, electronic health record, and we also, in our dental department, we have Dentrix, EDR. Both of those systems and databases flow into our data warehouse, which we use a vendor called Relevant for. That vendor also provides a front-end web-based visualization application to us, which you'll get to see later in our slides around hepatitis screening and treatment results. And that platform is out to all of our end users. So all of our EHR and EDR users are able to get on our analytics platform, which is web-based at any time, and see the results. We also use Tableau to do some other kinds of analyses of that information to present to managers and directors where we can't use our other websites. I'm going to go ahead and start talking about hepatitis C treatment because we're really excited about this work. So we started doing hepatitis C treatment many years ago, but we really have increased and really focused on it for the last couple of years. And the reason being is, first of all, hepatitis C causes really significant health problems for those who have the virus. Those patients are also at risk for liver failure and liver cancer. Our county actually has a high rate of hepatitis C infection, specifically around in women. And the rate of hepatitis C infection in younger adults is going up here. So generally has risen in our county. That combined with the increased tolerability of the treatments for patients. So with the newer treatments for hepatitis C, many more patients qualified to be treated and can actually tolerate finishing treatment. So we began to really focus on this when those new treatments really became available and became covered by Medicaid. So and by looking at a group of providers at the health center with expertise in hepatitis C treatment in primary care, proposed to our internal quality improvement committee a new program to begin treatment groups at Petaluma Health Center. And typically, group visits or shared medical visits are managed in our wellness department. So our wellness team started working on workflows, so looking at how can we best treat patients with hepatitis C in a group visit kind of system. So providers were recruited based on interest and expertise to facilitate these shared visits. We had a staff member on the wellness team trained to case manage these patients. We implemented guidelines for treatment from our managed Medicaid program, Partnership Health Plan. And then lastly, our informatics team, including Sean and myself, was engaged to provide EHR customization, clinical decision support, and analytics for the new program. also a little bit about the program, and then we're going to kind of walk through step by step what the health IT supports to that program are. So our program really has 3 phases. There's the pre-treatment phase, an initiation of treatment phase, and then a treatment maintenance phase. So in our pre-treatment phase, up to about 8 patients get together. This happens once or twice a month. They're in a group setting, and while they're in that group setting, they're getting education from one of our nurses who's specially trained in hepatitis C. We also have a nurse practitioner who's specialized in gastroenterology who reviews the cases with the medical assistant prior to the visit and pulls those patients out for one-on-one during that shared medical visit. They order any remaining outstanding labs, imaging, screenings, and they get the patient ready for treatment. So this is really an education session, and if there's any more workup that needs to be done, they do that at that time. Patients then move into a treatment initiation, and this is held also 1 to 2 times a month. This is done with a physician that reviews each case with the hepatitis C coordinator. They make a plan for that patient. Again, the patients come together in a cohort, in a group, and rather than being pulled out for one-on-one, those one-on-ones happen in that room. The provider goes around and will actually order treatment, start treatment at that time for each patient. Any vaccines that are due are administered. There are lifestyle and global liver health